childhood blindness was speaking on the tragedy of childhood blindness at the 30th anniversary celebrations of the Indian American International Chamber of Commerce at the Ronald Reagan Center for International Trade in Washington, D.C., March 31st. He is the CEO of a multinational dollar retail pharmacy company. With this, I call Dr. V.K. Raju.
I am very glad to be here today with all of you. Rajamandri మా స్వస్థలం, బట్ విజయవాడలో రోటరీ క్లబ్స్ తోటి లేట్ 70s and 80s, 90s దాకా ఎన్నో ఐ క్యాంప్స్ చేసాం. తెలుగు ఎంత చక్కటి లాంగ్వేజ్ అని అందరూ చెప్తూ ఉంటారు. ఆఫ్ కోర్స్ ఇట్ ఈజ్. తెలుగులో మా తప్పులని ఒప్పులుగా భావించండి అంటారు. ఈ మీకు నన్ను ఇంట్రడక్షన్ చేసిన దాంట్లో ఈజ్ ఎ చైర్మన్ ఆఫ్ మల్టీనేషనల్ ఆర్ $multi-million కార్పొరేషన్ నేను కాదు. సో ఆ తప్పుని ఒప్పులుగా భావించకండి. అది మా శిష్యుడు, అవర్ చైల్డ్, పోస్టర్ చైల్డ్ ఆఫ్ అవర్ ద ఫౌండేషన్ in Vijayawada in 85 or so, we found him with a major eye problem. నేను మరీ గట్టిగా మాట్లాడుతున్నా, వెనకాల వాళ్ళకి బాగా వినిపిస్తుందా, నేను దూరంగా ఉండనా ఏమైనా చెప్పండి. ప్లీజ్ టెల్ మీ. ఓకే, థ్యాంక్ యూ. అతను శ్రీను మద్దులా అని 2 ఏళ్ల టైంలో, when he was just 1.5 years old, he had a major problem of the cornea. Hereditary dystrophy antar, they are born with that kind of problem, cloudy cornea, he could not see anything. At that time, the wonderful Rotarians, year after year మేము చేస్తూ, they spotted out. దత్తా గారు అప్పుడు లేరు, బట్ దత్తా గారు ఇప్పుడు నన్ను పిలవడంతో దీంతో అది నా గురించి చెప్పుకోవడానికి ఎంతో అవకాశం వచ్చినందుకు నేను చాలా సంతోషిస్తున్నాను. సో శంకర్ గారు, పట్టాభిరామయ్య గారు, ఎంతోమంది ఉన్నారు మహానుభావులు. వాళ్ళందరూ మనందరం కలిసి చేస్తేనే ఏదైనా అవుతుంది. జిమ్మీ కార్టర్ wrote and on the cover a great book. I think you're all leaders, great leaders. I think how global vision to be successful అని ఒక పుస్తకం రాశాడు. ఆ పుస్తకం మీద జిమ్మీ కార్టర్ చివరి రాశాడు, టుడే there is so much of leadership without cooperation అన్నారు. ఎందుకు చెప్పారంటే, లాస్ట్ నైట్ there was a major lecture in Delhi from అపోలోలో గ్రూప్ డైరెక్టర్ ఉన్నాడు, క్లోజ్ ఫ్రెండ్. అతని టాపిక్ ఏమిటంటే, మనం హెల్త్ ఫీల్డ్లో హౌ కుడ్ బి విశ్వగురు ఇన్ హెల్త్ ఫీల్డ్, హౌ ఇండియా కెన్ బి విశ్వగురు. విశ్వగురు ఎలా అవుతామంటే, ఇంత గెలిచి రచ్చగెలిస్తే అవుతాం, ఇంత గెలిచి రచ్చగెలిస్తే అవుతాం. ఫస్ట్ క్యాంప్ విజయవాడలో చేసాము ఇక్కడ విత్ సంబడి ఎల్స్ బట్ రోటరీ రియల్లీ టుక్ ఓవర్ అండ్ ఆల్ దోస్ థింగ్స్. అక్కడ నేను అప్పుడు లండన్లో ఉన్నాను. లండన్ నుంచి అమెరికా వెళ్ళాను అప్పుడే, ఆ సంవత్సరంలోనే, జస్ట్ ఫ్యూ మంత్స్ అగో. నేను ఈ క్యాంప్ చేసేటప్పటికి ఇక్కడ చిన్నపిల్లలు ఐ ప్రాబ్లం చూసి I get a nausea. I never saw such children's problems neglected. We all talk about cataracts, age-related cataract. People when we become 60s and 70s, we all get cataract. But children can be born with cataracts. That cataract should be removed very early, sometimes a few days, few weeks, few months or at least. Avatade brain cells get neglected because you did not treat the child in time. Avanni chusin tarvata, after seeing all those, next time I brought an instrument, and there's a lot of coverage in the newspapers, and doctor on vacation serves the poor. And recently there was a beautiful article and advice in the Rotary International magazine, which comes monthly, which is a remarkable magazine. I will always try to look at from page to from the beginning to the ending. They said, don't sell all the pictures, press reports and all that. I don't know whether you all have seen it. Rotary International said those, but I'm just showing this is a baby we did in a Rotary camp is a few-month-old baby, and you can see the instrument sitting there. This is the instrument, is the first instrument. Some of your doctors must be here. Vitrectomy, vitreous in the gel in the back of the eye. There's a lot of problems can occur with the diabetes, with the aging, various causes. At that time, just this instrument is coming to do vitrectomy. Cataract after surgery, we have to do that. This is a very mechanical instrument with electronic, and when it came, when brought to Mumbai airport, I was kept like a criminal for almost 6 hours because they have never seen anything like that. At that time, in the airport, there used to be 40 to 50 inspectors used to be there. Last few years, especially since 1991, there may be 1 or 2 excise inspectors in the customs. That is the greatest change that happened in this country since 1991. To me, I left India almost 69 to England, but I feel I come back initially once a year, then 2 years, 3, 4, even 5 times a year, and I travel home to home. Leave home, come home, and leave home here and go home. And that one, really 1991, the change of innovation, the really potential of the country just started to happen in 1991. Chudandi, Aduguna, when I Foundation of America was born in 1980, I think it's a magnificent hall like this with the modern technology. I think they should not be having these things here. It is blocking the screen. So this is a little history of the Rotary Club. This is in 81, but since 79, 80 was all going on. And I got only few pictures. You can see these black and white pictures. At that time, there's no color photography. And you can see Dr. Shankar there. And as I said, so many incredible people helped us. That's how things will work out when we do it really together, really, not, gaddi parakalu sahitamu, ventiga nerpadi, madaputu enuguni bandhinchusanadi 250 BC. That is our culture. We need to look into something like that. And I saw a lot of adult patients. I'm much younger at that time. And, this is different people. We always, initially, it was all disorganized, but we kept on organizing because of the Rotary clubs persisted year after year after year. And this is all a press conference at that time. This is the kid, during that camp we found, came from Pula, West Godavari. Now I realize there is no West Godavari. East and West Godavari became one district. And he's the one, chief executive of a retail pharmacy, not me. So, aa tappuni uppuga bhavinchadi. But next time cheyakoodadu alativi. And he never forgot what happened to him. He is probably responsible through the I Foundation of America, reaching world over. We are in 30 countries. Of course, our main flagship is Gautami in Rajahmundry. There used to be children came from Mumbai to get to that cross-eyed operation, 78 to 79 low. Lot of people did not do, except in few cities, maybe few doctors used to squint operation, turning in eyes, but she came and she still sends, her husband sends a donation to Gautami periodically. She is almost like, I think we operated in 80 or 81. That the little girl came from Mumbai. Any problem in children is an issue, but vision is a more of an issue because 80% of our learning is through vision. If the child does not learn, a problem to the child, to the family, to the society as a whole, he loses 75 years of life. A 70-year-old patient did not get the cataract surgery done, did not happen, unfortunately. That patient, he has about 3 to 5 years to live, whereas a child, if he misses the chance of getting the vision, he is going to live for 75 years of blind years. So 80% of our learning is through vision. I think, there is something at the top. India, I always felt, people said many times, is a highly developed country with the developing country problems. We landed on the southern tip of moon where the Russia failed 4 times. Whereas we have the developing country problems, a highly developed, it's not a poor country. Like Nani Palkiwala said in his 80s book, India is a rich country, still kept poor. But things since 91, the things that are truly remarkable, but we lost a lot of decades. Lee Kuan Yew used to say, India, the sleeping giant of an economy, it woke up, but if you keep on looking what we achieved, then it's not the way to do. I'll show you a little clip from a favorite movie of mine. I always feel inspired. I might have come here 230 plus times. If we have the same discipline, same interest as we have in cricket and Bollywood, just somebody said 2 years is enough. This will be a highly developed country surpassing any other nation because we have the greatest treasure of 400 million smart people, youngsters below the age of 24. No country has it. I would like to just say, some of you may not get what I'm trying to talk here, but I have to show so that we can discuss later in our little bit of discussion. I hope you'll raise this point. I'm an adjunct professor at Johns Hopkins Wilmer Institute. I teach and I'm very fond of research and keep learning. My mentor in London used to say, when you keep learning, there is no frustration, no distraction if you keep learning. And they wrote about Johns Hopkins 220 years ago. He gave $4 million to Johns Hopkins University. It's a small little place at that time, maybe a few hundreds of yards or maybe 1/5 of an acre or something like that. 2 million should be used for the medical center, 2 million for the institution. Now, Johns Hopkins research, what they did in the last 100 years, we are enjoying, especially in the diabetes, in the eye I'm talking about, but in every way, in cardiology, neurology, and in the eye, what we are all enjoying, that the research of 40s and 50s and 60s. I am very fond of this institution. So, in that institution, there is a beautiful article came, and I just wrote, I read with interest about the life of Johns Hopkins and all that. The past is our cradle, not our prison. And there is a danger as well as appeal in its glamour. So it's wonderful to talk about our past, but that should be a small past. What we can really do, achieve, is what we have to think the potential of India is unrealized for me after so many years living abroad and coming back, being part of, traveling between home to home. This is a mathematics life. I think we have to have seen something like this. I put it in a different way. If A is 1 equal to 1 and Z is equal to 26. A is 1, Z is 26. Hard work, we always say, that means X plus 1, 8 is. Altogether, still hard work is 19%, 98%. So you think knowledge is so important, Adugan Kanpatla about 70% or so, something like that there. Luck, we say, I'm glad everything we think about, it's luck, nuditavu rato, 47%. They say everything is love. Love can conquer anything, probably it does, but in mathematics of life, it is only 54%. And luck, we said it already. Love, 54. What is 100% then? Is it money? Yeah, that's right. You should come and talk here now. Money is still money, 72. Leadership? No. So, what is really 100%? Attitude in 1980s, In his book, We the People, by Nani Palkiwala, he said, mindset. Let us change the mindset. Sky is the limit for us. And of course, I always did everything I did since here, I camps with the Rotary. And the Rotary four-way test and Rigveda's roots, Manasa, Vacha, Karmana, they are so similar. Nothing is impossible. As I said, I travel home to home, and Venkataswamy, Madurai Eye Hospital System, the biggest ophthalmic eye care system in the world. And I used to be a very good senior friend. I learned a great deal with them. Once I said in 85, how clean and tidy the hospital was there and all. When I praised, he showed one of the Gopuras of Madurai, Raju, our ancestors 1200 years ago when they built things like that, we have not done that yet anything, he said. I think that when you think about our potential, that's so true. There is the greatest advancements happened in the last 40 years. Just remember this for me. Last 40 years, 45 major breakthroughs in medicine, they happened. Incredible, no time in the history these things happened. Last 40 years, 45 major breakthroughs happened. One is a bionic eye, now a blind child without no eyeballs. No eyeballs, you can make him see, may not be perfect vision, can make him see with a bionic eye. But if every child can get it, is it fair we leave most of those and only help a few people? The second one is stem cell therapy. After diabetes, bleeding many times, by stem cell induction, we can give them vision. Gene therapy, somebody is born with a gene abnormality, consanguinity, especially in south, much more than north of India, because of Maneri Kalvala. And those are all can be helped today. Not a single person need to be blind if really our mindset and things changes. Otherwise, today, with all the advancements, a billion people walking on the planet, they need just a pair of glasses, that's all. They cannot afford an exam, or they cannot buy a pair of glasses even today with 1 billion people around the world. So these things, if they happen, will it be available for all of us? This is the kid, if you can change it. Otherwise, Srinu Maddula, the Chief Executive Officer, a major $250 million retail pharmacy company.
Hey everyone, my name is Srinu Maddula, and I've been with the Eye Foundation for a very long time. I was born in India in 1985 in a really rural, small village close to Bonn. I met Dr. RAJU through the Eye Foundation and the Rotary Eye Camp in Vijayawada in 1987. He had diagnosed my condition of basically being born close to blind to be treatable if it was operated on immediately. And so through the sequence of events in 1987, through the help of Dr. RAJU and the Eye Foundation, I was operated in both eyes, and I have nearly perfect vision still, 36 years later. The Eye Foundation is one of my dearest and most closest causes to my heart. It literally gave me life from a world of blindness, and it's changed the trajectory of my life. I eventually became a pharmacist, earned my doctorate, and went on to build a large pharma company. I've actually donated about close to $1 million of my own personal money to the organization because I believe in it so well and believe in the mission that it does. And I think the Eye Foundation of America does a lot, and I believe that.
Well, he said how grateful he is, and we are all grateful for him because he never forgot. He would like to see how many children we can give vision. He is from Pula, West Godavari. Probably next year, a district conference, he could not make it. We'd like to ask him to come and just address the people what it is in the Rotary Eye Camp. He could come and we could do that together. So that is, anyway, the voice looked like, Star Trek and all that. Probably you remember what is that. Yeah. Anyway, that sounds like I would like on the latter side. Thank you.
వచ్చెనని సభలే చేసి సంబరపడగానే సరిపోదోయి. స్వాతంత్ర్యం వచ్చెనని సభలే చేసి సంబరపడగానే సరిపోదోయి. సాధించిన దానికి సంతృప్తిని పొంది అదే విజయమనుకుంటే పొరపాటోయి. ఆగబోయి భారతీయుడా, కదలి సాగబోయి ప్రగతిదారులా. ఆగబోయి భారతీయుడా.
Thank you for giving me this as an opportunity to be with you all. And they always say that చెప్పేవాడికి వినేవాళ్ళు లోకం అంటారు. అలాగే నేను చెప్పలేదు. And I would love to ask some of the slides, if you disagree or you make a comment and make some of the things even better, if I can express, because always our audience are mixed audience, I'll be very grateful. Thank you. I'm very glad to be here today with all of you. Thank you.
Saradi, AV on Family of Rotary.